Okay, so um, the first thing that I have to do, we're talking about global health, and the first thing that I have to do is give you a bit of an idea about what is meant by public health and where this whole idea came from. So, my first slide is about the founder of public health, who was Rudolf Virchow. He was a German physician, and in 1847, 1848, his academy said, there's an outbreak of typhus in Upper Silesia, and we want you to go up there and do a report. And I'm guessing that the report that they wanted would say there were this number of cases of typhus and this number of deaths and this number of children and so on, and come back and give that as his report. But instead, he came back and he gave them a really extensive report. He said, these people are living in wretched poverty, filth, hunger, overcrowding, unemployment. It's no wonder they are dying, and we have to deal with these things. This is what public health is all about. And so he's now called the father of public health because his superiors were really shocked that it wasn't just a report about numbers. Instead, it was about what we have to do for the human beings. And this is his very famous quotation. It's often paraphrased, it's translated from the German. Medicine is a social science, and politics is nothing more than medicine on a large scale. And so I'm hoping that you'll be aware of that as we're talking today, that politics is nothing more than medicine on a large scale. And what we do in the political sphere is public health. The next thing I want to talk about is what we call the social determinants of health. And these are taught to medical students, and they are a very key part of the World Health Organization. So I'm going to go through them pretty carefully. This is telling you that when you look at why someone has a disease, if it might be a non-communicable disease like rheumatoid arthritis or mental illness, that it's not simply the disease in that patient, it's this patient and this place and why. So here are some of the things that determine why people get sick. Income and social status. The people who are living in poverty are far, far more susceptible to disease. Employment and working conditions. So not just having a job, but not being chained into your job or physically locked in. Education and literacy. The more educated the country, especially including women, the healthier that country will be. Childhood experiences. We're all really aware in Canada right now about the adverse impact of the terribly devastating circumstances in our residential school system that was set up for Native children, and was a horrendous system of torture and deprivation, malnutrition, and death among those children in the thousands. We're just starting to really understand that and come to grips with our history. Childhood experiences, I'm going to elaborate on this just a bit. We know now that what happens to you when you're a child not only affects you, but it also affects your children and your children's children. What happens is that childhood experiences cause the release of various hormones in your body, and those bathe the cells and affect the genes. Some of the genes that were unexpressed become expressed, and those might be genes that control anxiety, fears, anger, emotional instability, and so on. And this is called epigenetics. It's become a very big field in biological medicine, but also in mental health. So now what we know is that many people today are suffering from really pervasive anxiety and depression that actually came from a great grandparent. And that seems astonishing, but We find it particularly in survivors from Auschwitz and prison camps, and people who've survived war and deprivation in refugee camps and so on. So that is a social determinant of health because these people often have a shortened life expectancy. Physical environment is an obvious one. If there is not shelter and food and clean water, then your physical environment will be a determinant of poor health. Social supports and coping skills, these are learned social supports in your community and what is provided. And this is where we find that prejudice and racism and so on are so destructive of health. Healthy behaviors, probably don't have to go into that because we're so conscious now about washing our hands and being careful of cleanliness, but those were not known 150 years ago when Virchow was teaching. And in fact, he didn't believe in the germ theory of disease. At that time, he didn't know that typhus was caused by lice, body lice carrying Rickettsia bacterium. And that was the cause, the actual cause of the people having typhus. But it was all of these other social determinants that meant that they were really susceptible. And of course, they weren't able to stay clean. Access to health services is an obvious one. Your own biology and your genetic endowment, and now we know the epigenetic history that you have. Your gender, depending on what country you live in, you may live longer or a shorter life expectancy, in particular because women and maternal infant health are poor in some countries. In many countries, women live longer than men. Your culture also is a social determinant of your health, and your race and the prevalence of racism. So I want you just to keep those in mind for a minute. And whoops, I've got the wrong slide. Here's the right one. But just compare these for a second to, these are the United Nations Sustainable Development Goals, and you'll be familiar with them probably. There's 17 of them. So no poverty, no hunger, good health and well-being, I won't use that pointer, quality education, gender equality, clean water and sanitation. I can't read the next one. And decent work and economic growth. I wonder if I can make this bigger. Industry, innovation, and infrastructure. Reduced inequalities, sustainable cities. What's that one? Equity, responsible consumption. This is difficult. I hope you can see them better than I can see. Climate action, life below water, life on land, peace, justice, and strong institutions and partnerships for the goals. So there's a huge similarity between the sustainable goals, sustainable development goals, and those things that the social determinants of health. So good health is the result of all of these.
Number 7 was affordable and clean energy.
Thank you very much. Maybe I need to be projecting them full screen size on my own screen. So we know that the World Health Organization, whoops, he's out of order here. The World Health Organization was founded in 1945. And I first want to just focus on the importance of the fact that it was founded as soon as they founded the United Nations. World Health Organization was founded, and this again demonstrates the tight link between political organization and what we know about public health. So that one of their major successes, and I've talked about this before, is the elimination of smallpox, which was declared gone in 1982, but in fact, vaccinations in most places were completed in the 70s. And this was a horrendous disease that had killed millions and millions of people every year for millennia, actually. And then polio, that now we've almost eradicated polio. Excuse me. There's just 2 little pools where it's been very difficult to get in and get all the people immunized. But basically, we have almost eradicated polio. And as I've said in an earlier session, this is a huge tribute to the Rotary International, who raised $5 billion to promote polio eradication in the world. And then the most recent one is malaria, because it was just announced last week that we now have a vaccine for malaria. And as I was saying a bit earlier before we signed on, that this vaccine is far from perfect. It's been very, very long coming, very difficult to make a vaccine against malaria because it's a parasitic disease. But now they have a vaccine, and this will hopefully protect children. It takes four repeated shots to produce the effects, and it's only 30% effective. But even at that level, it's going to save tens of thousands of lives. So these are some of the triumphs of the World Health Organization. It has been a mainstay for public health in the world. These are some of the weaknesses of the World Health Organization. And one of the biggest ones is that, first of all, it's underfunded. Its total funding per year is less than a tenth of what the city of New York has in its budget. So to do all of the necessary activities of the World Health Organization, it needs a lot more money. And the important thing to note here is that only 20% is funded by nation states. So what that means is that the nation states have an amount that they are assessed, and most of them are paying that amount. But the budget is in fact 80% more than that. And that is donated voluntarily. Some nations contribute voluntarily. The Bill Gates Fund donates. But the difficulty with those voluntary funds is that they are targeted. So they are linked to a specific health issue, such as malaria. And that means that when there is something like a pandemic, a major emergency, WHO doesn't have a sufficient flexible budget to address a sudden emergency. Second thing is that national interests get in the way of public health. And we know that in many countries, that countries will choose not to invest in a public healthcare system, or not to invest in the protective equipment that would be needed in the event of a pandemic. And we've seen the results of these things, unfortunately, in spades. National leadership is weak. We certainly have national leaders who have said that they don't believe that there's a pandemic, or they don't believe that vaccines will help. And the result has been millions of people dying. Often nations don't put health as their first priority. They put travel and trade above health. And that was one of the problems in the beginning of this pandemic, was that when it was clear that this was a public health emergency of international concern, nations did not want it called a pandemic, and they hampered the leader, Dr. Tedros, from declaring that it was a pandemic, because they didn't want to stop international travel and trade. Lack of transparency, I don't think I have to explain that when nations don't share information, that's really has serious consequences for public health. Patent restrictions, we know this about, well, not only vaccines, but also restrictions on medical equipment make it very difficult for the poor countries to gain the equipment that they need. And simple lack of preparedness. This is this human characteristic that we, until we're faced with the emergency, we don't gather ourselves together and plan. I want to just focus for the last few minutes about the mental health crisis that is resulting worldwide. And I'm not going to go into all of the causes. I know that you know this, that isolation and fear and uncertainty and loss of income, loss of jobs, loss of housing, all of these things are contributing to huge, huge pressure on mental health all over the world. And particularly the challenges in hospitals, and those challenges are not easing up. This is an extremely difficult thing to face. However, mental health challenges are something that affect all of us, and that's why I'm focusing on it right now. I want to look at what are the social determinants of mental health. And then in our breakout rooms, I like you to think about the things that give you a source of meaning in life, because these are the social determinants of our mental health. First of all, our basic needs have to be met. We have to have food, clothing, shelter, and fresh, safe water. Relationships are extremely important, and this doesn't have to be your family relationships, friendships. It's community relationships as well. It's your relationships with nature. It's your relationships with people that you meet, both casually and in service. Service to others is a very important determinant of your mental health. And in fact, Viktor Frankl wrote a book called Man's Search for Meaning. He wrote it as a result of being in the Nazi concentration camp during the Second World War. And he was looking at those people who managed to stay not in a state of despair in spite of the horrendous circumstances. And he said that service to others was probably the most important source of their meaning in life. A sense of belonging, we know this particularly from looking at adolescent violence and adolescent apathy and disruption, that they need a sense of belonging, and that when we offer year plays and school bands and ways that young people participate on teams where if they're not there, they're really missed. Those things are all really important. And so this is also important for us to maintain our own mental health, as we somehow need to maintain our sense of belonging to a larger group. Another is the sense that there is something greater than ourselves, whether you call this spirituality or something else. That is another important sense. Meaningful work, and sometimes this does not mean your paid work. It means other things that you do that have deep meaning for you. Source of beauty or sense of beauty. I know that Viktor Frankl talked about looking out through the fence to see the beauty of a sunset and how meaningful that was for him. For some people, it's music, it's art, it's theater, it's nature. Those are just some of the ways that we find a source of meaning in life. And I did a talk to the Assembly of First Nations at one point about sources of meaning in life. And I just asked them to go to flip charts and write down the sources of meaning in their lives. And they filled walls of flip charts with the sources of meaning that they have, whether it was drumming or music or sweat lodges or the elders or the community. It was the community traditions, the storytelling, and on and on. And I keep thinking that those sources are so important to the survival of those people who are the survivors of the residential schools, that those are giving them a foundation now for going forward.